It will be the first such facility to be set up in the region by the Public Health Ministry. It will be a mobile testing site in the compound of the Port Mourant Hospital. Doctor in charge, Dr. Sonia Lord, says the facility is open to anyone.
We're asking residents if you think you may have COVID-19 or you're experiencing signs and symptoms of, which everyone should know by now, which is the fever, the cough, the tiredness, or have been in contact with anybody who has been experiencing any symptoms or has traveled from an area where we know that COVID-19 is rampant, and you think you have symptoms, you can come to this testing site where you'll first be screened. So there are two categories of screening. The primary screening, where your temperature will be taken, a series of questions will be asked. If you do meet the criteria or you have signs and symptoms that suggest that you may have COVID-19, you further go into a secondary screening.
This process, she demonstrated, is where a doctor will carry out further checks, provide counseling, and then they will advise on the swabbing techniques and process. Persons will also be advised on whether they should be quarantined. Then there is a sample which will be extracted.
So this sample taking is basically what we call a nasal pharyngeal swab, in which we take a long Q-tip and we ask you to cough for us or blow your nose in a tissue as hard as you possibly can. Then you extend your neck and we insert this Q-tip into your nose and we do like a 360 rotation swabbing. You may feel uncomfortable because it feels, as I would say, a brain freeze. And we take the sample, and then this sample is taken down to the National Reference Lab.
Those results will be back within 48 to 72 hours. Persons will be contacted on the results of the test. However, if the person is in quarantine and there is enough suspicion, authorities will commence contact tracing even before the results are out.
Contact tracing, we will try to get the family in the household or even all the other persons the individual would have come in contact with at some point in time. It should come back positive, especially the immediate or closest who have contact. We would directly put into institutional quarantine.
The facility will be open from 9 hours to 15 hours. 5 nurses and 2 doctors will be assigned to the unit.
We would like to commence it as of tomorrow.
Similar units have already been set up in Region 4, Demerara Mahaica, which is considered the COVID-19 epicenter in the country. Andrew Carmichael, The Evening News.